is the author of the Quality Care for Moms and Babies Act. Thank you for your solid work, Mr. Engel, and you're recognized for 5 minutes of questioning.
Thank you, Madam Chair, and thank you for holding this very, very important hearing. And thank you to all the panelists. Thank you so much. We appreciate everything that you've done. Ms. Irving, I want to single you out because what you're doing today takes an enormous amount of courage. And so God bless you, and know that we support you, and what you're doing today will save the lives of countless other people tomorrow. So thank you for having the courage. I want to thank the chairwoman and the chairman, Pallone, for holding today's subcommittee hearing on the nation's maternal mortality crisis, and which includes my bipartisan, as the chairman said, bicameral legislation, the Quality Care for Moms and Babies Act. The bill would bring together diverse stakeholders to develop care quality benchmarks for women and children, as well as to also find existing and new quality collaboratives. Quality collaboratives are on the front lines in the effort to end this crisis. The New York State Quality Collaborative has developed resources to address the leading causes of maternal deaths in New York, which include hypertension and hemorrhaging. And these resources were distributed to over 126 birthing hospitals in New York. So I urge members on both sides of the aisle to support this common sense bipartisan legislation. I would also like to ask for unanimous consent to submit a letter of support from 8 organizations, including March of Dimes, the American College of Obstetricians and Gynecologists, in support of the Quality Care for Moms and Babies Act. Dr. Howell, it's always good to see more New Yorkers in Washington. I get lonely over here, so please come back. And thank you for the great work that you do and that Mount Sinai does as well. Mount Sinai, of course, is very well known in New York and very well respected. So I want to personally thank you, Dr. Howell, for your service on the New York State Task Force of Maternal Mortality. And it's my understanding that the task force issued a report this past March in which it recommended expanding the New York State Perinatal Quality Collaborative. And as you know, as you mentioned, which I appreciate you mentioning, and I'm sponsoring the Quality Care for Moms and Babies Act with my friend Congressman Steve Stivers. So it's a bipartisan bill. Our legislation authorizes funding for existing and new perinatal quality collaboratives. Let me ask you, Dr. Howell, can you again share, because I think it's worth repeating, why developing and sustaining perinatal quality collaboratives is an important tool for addressing racial and ethnic disparities in maternal health outcomes?
It's a very important tool for us to use across the United States as well as in New York, because it allows us to have partnerships with physicians and nurses, with departments of health, hospitals, and health systems to target specific processes based on the evidence that we can target together to improve. And we've done it in a number of different situations, not only in terms of the bundles that you've heard about, but in terms of trying to lower our cesarean section rates, in terms of our elective delivery rates. We've done it on the NICU side. And so it's these groups that can take the shared learning and utilize that to help make improvements in hospitals. And your bill supports that, and I think it's a really wonderful and important part of this story that we need to advocate for.
Well, thank you, and I have high hopes that we'll pass the bill and pass it on the floor and hopefully get it passed in the other body and have the president sign it into law. So thank you for everything you're doing. Dr. Harris, let me ask you, in your written testimony, you note that the quality of maternal care can vary greatly by provider and facility, given that public health programs cover most births in the U.S., with Medicaid alone covering 43% of them. I believe, obviously, these programs are uniquely situated to improve maternal health. To that end, the Quality Care for Moms and Babies Act would direct the development of a core set of maternal and infant health performance measures for Medicaid and CHIP that promote best practices. So let me ask you, Dr. Harris, how would the creation of this measure core set affect the quality of care and reduce maternal morbidity and mortality, especially for women of color?
Congressman Engel, if you don't mind, I'd like to let Dr. Howell talk about the specifics of that, of the core metrics and how they would help. But from sort of the 30,000-foot view, it's very important to have the data. data that then informs, and that's again why the AMA is very supportive of these review committees. You've heard a lot today, but there is no sort of one-size-fits-all solution, and patients are unique. And as Dr. Howell mentioned earlier, California's done a great job of reducing mortality, but not African-American women. So we still need to look at the data and why overall mortality decreased, but not African-American women. So I think the opportunity there is to get that data, get the data specifically for African-American women. And then once we get the data, it's important to have funding to implement what we find in the data. So I would say that from a 100,000-foot view, and let Dr. Howell talk about specific measures that should be included to improve those disparities.
Well, thank you. If the chairwoman will indulge, we'll have Dr. Howell.
So I think it's incredibly important that we develop quality measures in maternal health care that are both patient-centered and address disparities. You know, we've done work showing that hospital performance on primary low-risk cesarean or hospital performance on elective delivery is not correlated with hospital performance on severe maternal morbidity. So the current group of quality measures don't really provide information to mothers about the different facilities in terms of safety, and they weren't correlated either with neonatal morbidity at term. We need better quality measures that can serve and we can give to the public so that they can better understand what's going on. So your bill that advocates for quality measure development, I think, is really instrumental and a very important piece. And having quality measures also target disparities and address disparities is another piece, because previous data shows that the quality measures in obstetrics really are not doing that either.
Thank you, Madam Chair, for your indulgence, and thank you for all the great work you are doing.
Thank you for your work, Mr. Engel, and this sounds like a resounding, we recognize endorsements, don't we, when they occur? I think I just heard one. I now would like to recognize the gentleman from Illinois, Mr. Rush, who I'm really pleased to be joining him in his congressional district in a handful of weeks, where he is conducting a field hearing on this very issue, and you are now recognized for 5 minutes for your questions.
I want to thank you, Madam Chair, and I certainly want to applaud you for holding this critically important hearing. Ms. Irving, I feel you. I understand some of what you're going through. I'm reminded just this very day that some 10 years ago, this very same subcommittee, had a hearing on postpartum depression. I had introduced a bill entitled the Melanie Block-Stokes Postpartum Depression Act of 2007. And her mother, Melanie Block-Stokes' mother, Miss Carol Blocker, sat at the very same table that you're sitting at some 10 years ago. Melanie was one of my constituents who had been seeing a series of doctors postpartum, and none of them diagnosed the depression that she was going through. And she ultimately, on a bright Saturday morning, spring Saturday morning, went up to a hotel in Chicago, on the near north side of Chicago, and leaped to her death from the 10th floor. And the cause of it was